I started the stream.
Let everyone come on. Okay. Perfect. Hi everyone, thank you for joining us today for our virtual dental shadowing session. We want to remind you that in order to get your hours, you'll have to take a short quiz, and as long as you get a 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Neelab and Dr. Cyrus for today's session. I'm handing the mic to you guys. Feel free to start whenever you guys are ready.
Hi, everyone. My name is Dr. Neelab ANWAR, and this is my husband, Dr. Cyrus.
Hi, everyone.
We're excited to be here and just talk to you guys about our pathways and a little bit about our profession. So just think of any question you guys may have, and we'll hopefully address them after. So a little bit about us. So we actually met in orthodontic residency in Rochester, New York, fall of 2018. A year later, so we were engaged in 2019, had a small wedding ceremony that summer. Hopefully this summer we'll have a little reception, COVID permitting.
Yeah.
In our free time, I mean, we love playing tennis, golf, we love exercising, traveling, and just spending time with our friends and family. We are from opposite ends of the country. So I'm from Southern California, San Diego area, and he's from the Maryland, DC area. So you guys can kind of hear both of our pathways. And we get this question a lot. So I like to start off with this first. So how did we even get interested in dentistry, and why did we choose ortho? So I'll kind of go first, but in terms of general dentistry, I have many aunts and uncles who are general dentists. So growing up, just always seeing them so excited and loving what they do. I was always in their practice. So I kind of grew up with dentists. And then in terms of ortho, me and my sister, we always just were fascinated with the idea of having braces, and we'd always pretend we had them. And then we got braces in middle school. And when I got them off, my whole personality changed. I just felt so much more confident, and I thought to myself, okay, I want to be a part of this specialty. And then I started shadowing in high school, college. That's when I really decided I wanted to be an orthodontist. And I love it because every day you play a huge impact on your patients. You're pretty much you play a huge milestone. You're part of a big milestone in their lives, and you get to build relationships with them. An average treatment time is around 2 years, so you get to know them and their parents really well. It's a great work-life balance. We'll go into this later, but you have a lot of flexibility with how many days you work, how many hours, and it's not physically straining on your body, and it's not very stressful, which is great.
Yeah, for me, my grandfather was a general dentist. So, growing up, I always enjoyed going to the dentist because it meant I got to see him. So I was always a little bit interested in dentistry, but it wasn't until high school when I had my own orthodontic treatment that, I really came to be interested. And this was done by me shadowing and volunteering at my orthodontist office during my summer vacations. So I would go in once or twice a week and really just spend time in the office and kind of see what they did on a daily basis. And I just love the whole atmosphere, the environment, being able to help people out, give them a beautiful smile that will improve their confidence. It's a really special profession. And I know that Neelab agrees with me that we think it's the best out there. And it really does give you a great work-life balance because one of the best things about orthodontics is you can own your own practice, and in doing so, you're able to set a lot of your hours as well as days per week that you work, and you're able to have a lot more flexibility to do other things like spend time with your kids or family and friends, to travel if you so choose. There's really just a good balance that you're able to maintain with orthodontics.
Yes, so these are our pathways. So Cyrus, you can.
Yeah, so like Neelab was saying, I grew up in the Maryland, Washington, D.C. area. I was there my whole life. I was born and raised in Bowie, Maryland, and then I went to a college prep school in downtown DC, right by the Capitol. For undergrad, I also stayed in Maryland, and I did my bachelor's there in bioengineering. And then I also went to Maryland Dental School. So I didn't really make it out of the state until ortho residency, but overall it was a great experience. And then finally I made my way up to Rochester, New York, for the Eastman Institute for Oral Health, which is one of like the top ortho residencies in the country.
And then for me, so I was born in San Diego, California, pretty much grew up in Orange County. And then my family, they now live in Temecula. So I went to high school there. Temecula is like north of San Diego. Went to California State University, San Marcos, the state university, and I commuted for those 4 years. Got into dental school right away at USC in Los Angeles. And then I ended up in New York because I got into my dream ortho program. This is in Rochester, kind of upstate New York area. And yeah, that's how we met. One thing you'll realize about us is that we did go straight through school. So we both didn't take any breaks. But what you guys should remember is that everyone has their own journey and there's no pathway that's right or wrong. I have a friend who's currently a general dentist, been practicing for 2 years, and now she wants to become an orthodontist. I have friends who applied 3 times to get into dental school. I know people who traveled after college, applied to dental school a year later. So you guys have a lot of options and there really is no right or wrong there, okay?
Yeah, out of my class, there were 6 of us for orthodontics, and only 2 of us went straight through. The other ones either took a gap year, or some of them worked as a general dentist for like 10 years. So there's really no right or wrong. It's just, you know, whatever your journey turns out to be.
Yeah.
So just like earlier I was saying, I went to the University of Maryland. I studied bioengineering there. I was always very interested with like math, and I figured bioengineering would be a good blend of math and science in order to prepare me for dental school. I think one of the biggest things in terms of getting into dental school is, you know, obviously having a good GPA and a good DAT. You know, those will definitely help you get interviews, but you also need to be a very well-rounded applicant. You know, I was a leadership roles in the pre-dental society. You know, I was constantly shadowing at different offices. Like I mentioned, you know, my orthodontics office. I also shadowed at several general dental offices as well, which is very important, especially applying to dental school. And then lastly, you also need good letters of recommendation. So just make sure to get to know your faculty members. That way they can write you a nice personal letter of recommendation.
Yeah. And for my undergrad, so like I said, I went to State University, commuted from home 4 years, which was great. I was a bio major with an emphasis in physiology. Right from the get-go, it was nice because this university was a little bit newer and I wanted to have a lot of leadership roles and just be a part of things I was interested in. So I was a tutor in like science, math, biostatistics, organic chemistry. I was part of the pre-dental society. I try to organize a lot of service projects, like work with the homeless, you know, organize dinners for them. And then also I was lucky, I was able to shadow general dentists at this time, but then also I would go to a low-income dental clinic like twice a week, and I was able to teach like oral hygiene and assist dentists. So that was really great. I would go with my best friend and it was super, super fun. And at the same time, I was able to get shadowing hours, so it worked out. And then one thing to remember is that if you guys are trying to get into dental school, when you're in college, you want to focus on becoming a dentist. So even though, let's say your dream is to become a specialist, you want to focus on one thing at a time. So shadow general dentist, and also you want to take the DAT. Okay, so I took mine, I think 3rd year because I wanted to get in right away. And then also, like Cyrus was saying, develop relationships with your faculty. You want letters of recommendation and a personal statement. So it was always helpful for me to create a timeline and do things in a timely manner if you want to get in right away, right after.
Yeah, and one thing you'll notice is that, she majored in biology and I majored in bioengineering, but there's no right or wrong major to apply to dental school. I had plenty of kids in my class who did business. There was one girl who did sculpting, and really it doesn't matter what you majored in. You still have to take the same science courses and obviously do well in them. But it's almost a benefit to not necessarily major in just a science, because having college is the one time where you're really going to be able to kind of branch out and learn a bunch of different new things, whereas in dental school you have a very strict curriculum that you have to stick to. So if there's anything in particular that you're super interested in or passionate about, don't feel scared to like major in that, because at the end of the day, dental schools won't necessarily look unfavorably with that. As long as you do well in the science courses, they'll almost like it that you majored in something else, because it brings some diversity as well as a different perspective to their dental school.
Yeah, that's a good point.
Yeah, so for dental school, I've stayed in Maryland. I went to the University of Maryland, which is a great dental school. While I was there, I knew I wanted to do orthodontics from an early age, but I still kind of kept my mind open, and I looked into oral surgery as well, since I really enjoyed like pulling teeth. But in the end, orthodontics kind of won out, and I spent a lot of time shadowing the Maryland Orthodontics Clinic, getting to know the residents and the faculty, again, because, you need letters of recommendation. Going back to leadership, I was in the orthodontics interest group. I did a lot of community service. Same as applying to dental school, getting into ortho residency, you have to be very well-rounded. So it's not just about having the grades, you need to be involved in a lot of other things.
Mm-hmm.
The last thing you have to do is take the GRE, and this is dependent on which ortho programs you apply to. So orthodontics isn't like a lot of the other specialties in dentistry. The issue is that every ortho program wants something different. So you have to be very, very mindful of that, and be very organized to know exactly which schools require different exams and so on and so forth. So the majority of them, though, do require the GRE. And some of them do require this new exam called the ADAT, but that wasn't required when we were applying.
And then for me, so I went to USC, graduated dental school 2018. So now once you're in dental school, you can focus on, becoming that dream specialist if you do want to specialize. So for me, orthodontics was ingrained in my heart and soul. So from day one, I joined the ortho club, had a leadership role in our ortho study club, shadowed our ortho department at USC. Orthodontics, a lot of programs favor research. So I did have a publication, which was great, was involved, had a research project, and then I knew I wanted to get in right away. So again, I made sure I had my letters, my statement done. I took my GRE my second year to just get it out of the way. Have a nice CV, make sure you're always like kind of updating that. And then I was shadowing outside orthodontist as well, outside of dental school. But yeah, if you want to get in right away, just apply a year before you graduate.
So EASTMAN, so, it's funny that, I'm from like DC, East Coast, and she's from the West Coast, and we both ended up in Rochester, New York. And the reason is because this is a great program. So it's not as like popular or well known as some of the other programs, but this is actually where both of our orthodontic mentors went to. And it's really great program. It's only 2 years, which is nice. Most orthodontic programs are 3 years. And then in addition to that, they also pay you a stipend. So you actually get paid to learn while you're there, which is nice because a lot of other ortho programs actually charge tuition, and that can be as high as $100,000 a year. That being said, we got a great clinical experience there. We did a ton of cases, and we learned a lot about clinical practice, as well as, the business and finance of running a private practice. I don't know, I really enjoyed our time there.
Yeah,
Like
that's
it's
great.
like a family, you know, you're with the
Right.
same people every single day. So you get really, really close. I still talk to my co-residents,
Right.
you know, daily, if not weekly.
Yeah.
So yeah, it's a very special time.
Yeah, and
you
it's
know, in
like
your
you're
career.
finally, you know, fulfilling your dream. You know, it's the end point of your education, and they treat you like a orthodontist. Like you go, you see patients. Sure, we have some lectures here and there, and then in your last year, I mean, you apply to jobs, and it's just a super exciting time. And like he said, I mean, I didn't know I would meet my husband there, and then you meet like your mentors, your lifelong friends. I mean, I just spoke to one of my co-residents today for like 2 hours. And it's just really nice. It's like a family, and I think we are really lucky to get in here.
Yeah.
It's great. I mean, there's tons of conferences you guys go to together, and it's just very close knit. Like there's only like 4 to 10 spots at some programs. Some of the bigger ones, I think maybe 15.
Yes, there's a few that have more
spots.
spots, but
Yeah.
in general, it's just nice. You know, once you
Right.
finally get to residency, it's kind of like you're doing what you've always
Yeah.
wanted to do. And then in addition to that, you know, it's not as competitive. You know, even in college, you know, everybody's competitive trying to apply to dental school, and then in dental school, everyone's competitive because they want to apply to ortho. But once you're finally in residency, I mean, there's really no competition or anything like that. So it's a very relaxed, you know, and more fun and collegial environment.
Yeah. And so it's funny, this
Yeah.
slide, you can see the difference between the graduation. So Cyrus, he graduated in 2019, and then me, I just graduated June of 2020. So I had a COVID virtual graduation.
Yeah.
Yeah. So some advice, these are like some general for pre-dental students. Kind of stay organized. I love having a planner and making timelines. One thing they discussed is like any study tips that we have. For me, I think again, just like just staying organized, writing like with colors, stuff like that. Having a whiteboard. I loved like teaching others, like my friends.
Especially for organic
Yeah.
chemistry, I
Oh,
feel
yeah.
like a
Right.
whiteboard is helpful just to kind of
Right.
like draw things out.
Yeah, in college, it was nice. I lived at home, and like my parents would bring me snacks, and I would just be studying like on my whiteboard, just practicing out loud, and it was so helpful. Shadowing different fields. So sure, like we loved ortho since, you know, we were younger, but figure out what you love. Shadow, like, you know, contact. I know times are hard now, but you can email, call the offices, and see if you can kind of get in the door and see what they do for a day, okay, or even half of the day. Be involved and well-rounded. So orthodontics is nice because they want a really well-rounded candidate. So it's not just like being book smart, but they want to see how you'll be with patients and how you'll handle, like, you know, so many patients per day. And so overall, just focus on not only academics, but leadership, volunteering, any service, research, but also have some sort of healthy stress release. So working out, or, you know, your favorite shows, hobbies. So, I mean, I love playing piano and tennis. And then again, if you do want to specialize, we recommend finalizing your specialty by at least the end of second year in dental school. It just makes things go smoother that way. And don't forget to enjoy the whole journey, because time really does fly.
Yeah, I can't believe it.
Yeah. And then another question was, how do we stay motivated, or how did we stay motivated throughout this whole process?
Yeah, I mean, for me, I knew exactly what
Yeah.
I wanted, and like I didn't necessarily write down my goals, but I feel like
Right.
that would be helpful, and just always be focused on your goals, because you know it's a really long process, and I feel like most people aren't willing to make the upfront investment or sacrifice for the long-term gains, and it's really worth it in the end, you know, especially, you know, now that we're at that point where you know, we're no longer in school, and we're finally like reaping the benefits of all that. You know, it's definitely hard at points, and you get kind of down. Just always keep your end goal in mind, and just stay focused. You know, it's tough.
Yeah.
That everybody goes through it. You know, there were points in dental school where
Yeah.
you just feel like there's no way I'm going to get into ortho, or even in college where you're like, there's no way I'm going to get into dental school. And you really just got to keep trying, even if you don't get in the first time. You know, a lot of people don't get in the first time, and that's okay. It just means that you'll get in the next year. So just keep trying, and don't ever give up. If that's something you really, really want to do, you will make it happen. And honestly, it's totally worth it, even if you have to try several times before you get there.
So now we'll go into our field. So what is orthodontics? I mean, not only are we fixing like misaligned teeth, but also misaligned jaws and bite patterns. So it's nice that we can diagnose, prevent, and treat dental and facial irregularities. And it's nice that we treat existing problems, but we can also identify problems that are developing, and we can take action to kind of resolve the problem before it fully develops. So we'll go more into that, but we treat patients of all ages, which is great. I mean, children's, teens, and adults. So you guys, I don't know how many of you all have had braces, but you kind of will understand a few things here. We do clear aligners. We also do what we call phase 1 or early treatment. This means that we can, identify problems early on and kind of resolve them before it gets worse. So I'll just point out an example real quick here. You can see this crossbite with the 2 bottom teeth in front of the top. So if we were to leave this and those teeth are hitting each other constantly, well, there's a chance that they can lose those 2 lower teeth, okay? And this gum line can go lower and lower. And so it's nice that we can do something early and fix that. We also,
and I think we have a case
we'll show
with
you
that
guys
later.
too.
We'll show you guys specifically.
And we also work with the oral surgeon to with jaw surgery cases. So if somebody has a lower jaw that's too far out or too far back, or with their upper jaw, we can work with them to get a nice outcome. So a day in the life of an orthodontist. So kind of what you see in this picture, it's a lot of talking, critically thinking on the fly. You're diagnosing, you're treatment planning, you're going chair to chair, talking to the patients and their families. So we'll go more into detail with our day, but I mean, we see like can range 30 to 70 a day. Each day is different.
And there are some offices that see 100 patients a day. It just really depends on what pace you want to move at.
Yeah.
So.
And the reason why we can see that many patients is because of staff. A good staff can help things go smoothly, and they help with a lot of the adjustments and stuff like that. And we'll go more into details. So for us right now, we work at a large pediatric practice. We have 3 different locations for ortho. We like to start early, so like 7:30 to 5 typically. And in the mornings, we have like bondings. We do a lot of consults and the adjustments. And then in the afternoon, we see all these kinds of appointments. And I'll go more into detail with each of them. So consults. So orthodontics is a lot about new patient consults. They can be children, teens, adults, people who visit the orthodontist for the first time. So maybe they've been referred by their dentist, or maybe they just want to fix something about their smile. So typically what we do is we take a panoramic x-ray for the consults, and if they want to sign up for treatment at their next visit, we'll do photos, a cephalometric x-ray, and put the braces on the same day. And then if they're a candidate for clear aligners, we take a 3D scan with our Trios 3-shape scanner, as you can see here. So bondings and debondings, this is one of the most exciting days in our field because you're getting your braces on or you're getting your braces off. So they're typically like 1-hour appointments. It's super important because, this will kind of determine the rest of how the treatment will go. So it's very technique sensitive when we put the braces on. We use a lot of material similar to like doing or a filling in general dentistry. They're just at different concentrations for orthodontics. So you also want to make sure they're in the right spot, right position, because each bracket on the teeth will like determine the specific movement. And then we typically take like starting photos, lateral ceph, and panoramic x-ray. And then when we take them off, it's pretty easy. I mean, same thing, super painless and quick.
They pretty much just pop right off with a special instrument, but it's always the most exciting part of orthodontic treatment is when we get to tell a patient that, you know, they're getting their braces off that day. You know, some people cry and some people are just so happy, and it's really probably the most rewarding experience for us is, you know, being able to tell them they get their braces off, and then when they get to see like their brand new smile, they're always so happy. So.
Yeah, it's one of the most rewarding days, I would say.
Yeah, that's my favorite part of the job.
Yeah, definitely. And then adjustments. So we won't go too much into detail, but like for those of you who've had braces, it's typically known as the appointment where they change the colors. So at this appointment, it's important because this is where we like make a diagnostic decision as far as what wire to put in, where they are at with treatment. It's typically quick, and there's many different wire sizes and everything. You guys will learn this in residency. And this is a nice picture, like kind of labeling what everything is, like the wire, the bracket, the rubber bands to fix the bite, and then a power chain to close the spaces, and then the O-rings or an O-tie are those colors.
Yeah, and this is where the majority of treatment happens. So even though the orthodontist like comes by and like they just take a quick look and they're like kind of in and out in just a couple minutes, like it's all this internal decision making, kind of like seeing where the case is at, what needs to be done. And then the nice thing about our profession is that we get to delegate a lot of that to our assistants and hygienists. So it's not as physically demanding as other specialties are, you know, where your back might start to hurt or other things like that. You know, in orthodontics, it's mostly a thinking game, which is one thing that I really love about it.
Right. So, I mean, we're the ones to pretty much critically think, diagnose, and it's nice that we can delegate tasks to our assistants and staff, and the day just goes by very smooth. So other appointments we have, retainer checks. So important to wear your retainer. If you do not wear it after you have your braces off, your teeth will move and they're gonna have to get braces again or clear aligners. Records appointments, so that can be like photos, taking a 3D scan, any additional like x-rays, observations. So that's typically when we see if they're ready for treatment. So sometimes they might be still too young. They'll come back and again in 6 months to a year, we'll kind of make that call. Checking an appliance, so you can see here there's an expander to kind of widen that top upper jaw. So we'll pretty much check if they have enough expansion there. Emergencies, so we're very lucky that in our field we have no kind of real emergencies. The worst that can happen is a broken bracket or a wire poking, all of which can easily be fixed. So it's nice, it's different than medicine where you're on call and you know you have very stressful
yeah, it's not life or death in orthodontics. You know, it's not like neurosurgery or some other complex surgery where you're operating on somebody and you know there's always the risk of like losing the patient. You know, and like Neelab was saying, like I think one of the nicest things is that you know we really don't have true emergencies. I mean, the wire's like poking, it's a very easy fix. They come in and we clip it in like 10 seconds. You know, it's not you know, like being a doctor where you're on call at the hospital and you know it takes you away from your family constantly. I have a lot of relatives who are physicians, and you know that's one of the things that you know is toughest for them is being on call. So yeah, so I mean, just going into kind of like what the salary is like. So it really ranges and varies because orthodontics is such a unique field. You really get to choose how much you want to work, and obviously, like depending on how much you're working, your pay is typically directly associated with that. So, you know, most orthodontists will work between 2 to 5 days per week, with the average probably, I guess, being like 3 to 4. But that being said, you can still work 2 days a week and be very comfortable. And if you really wanted to make more, you could work 5 days a week. Although I don't know many orthodontists who are working 5 days a week, just because most dentists like to have that 3-day weekend every weekend. But like the typical pay as like an associate in like a private office is probably around like $1,200 per day. And then you can obviously make more at like a corporate location. The average there is probably closer to like 1,500. And again, this varies depending on which city or location you're working in. Obviously, if you're like in a place like New York City or Los Angeles, the pay is going to be a little bit lower, just because it's not as like it's more saturated. Whereas if you go somewhere more rural or to a smaller city, you can actually make a lot more money just because there's much higher demand there and less competition. Where you can really do well is if you own your own office, and this is kind of like the goal for everyone, because then you can easily make like in the millions if you're doing very well. And really the bigger benefit is not necessarily the money, but the fact that you really have control over your office and how you want to practice, what procedures you want to do, as well as, what your hours are going to look like, how many days a week you work. If you like to travel, you could easily just close the office down for a week and travel. I know some orthodontists who really enjoy skiing. So, every like 6 weeks, they'll like take a week off and go skiing. And then there are plenty of other orthodontists who only are open 2 or 3 days a week. So it's really just the flexibility that you have to kind of choose what you want to do and adjust to your lifestyle. When you have kids, maybe you want to make sure that you're done by 4 o'clock or so. That way you can like go to their soccer games or their soccer practices. And you really have that flexibility to do that, which I think is one of the nicest things about our profession. There's also like teaching. You can teach as a clinical faculty or work in like a residency program to teach the up and coming orthodontists. That's also a nice option. Yeah, and one of the things that I get most excited about in orthodontics is probably because of my background in engineering, but I really like the technology. So right now, everything's going digital. We have 3D scanners as well as a 3D printer in our office. And it's really nice. This morning we had a patient come in and we were able to 3D scan the patient. And then immediately I was able to do the custom treatment plan for her aligners, her clear aligners. And immediately we could start printing things. So it's really nice. And I think, as we progress, the next like 10 years, technology is going to play a huge role in orthodontics, making treatments more customized and more efficient. In the past, a lot of times when I'll talk to my patients, I'll be like, okay, we'll be done in about 1.5 to 2 years. And they're shocked because, back when they had braces, it was like 3 years, sometimes 4 years, maybe even longer than that. And really with the technology that we have in place, we can typically treat cases much more efficiently, as well as give patients more options. Back in the day, it was all just metal braces. Now we have ceramic braces. We also offer lingual braces, which are braces on the insides of your teeth. And then we also have clear aligners, which I'm sure everybody has heard about. And those work great in the majority of cases, but you have to wear them. That's probably the biggest issue is compliance. So if the patient isn't wearing them or not willing to wear them that 22 hours a day, it's probably not going to be as an effective of a treatment.
And no more goopy impressions.
Yeah. So like I'm really bad about that because I have like a bad gag reflex. So anytime my partner would have to take an impression on me in dental school, I always felt bad for them. And after you have like a little kid who you have to take an impression on, they like throw up on you, you'll never want to do that again. So it's really nice, being able to take these 3D scans. They're much more accurate and much more comfortable for the patients as well. Yeah, so kind of going, off of that, I think the future of orthodontics is going to be heavy into technology and really understanding that technology and being able to utilize it efficiently in practice. There's so many new things that are coming out, whether it's indirect bonding, which is where we place the braces on the computer and then we have like a little model 3D printed out so that we can just put all the braces on at one time very quickly and efficiently. And then also like the new advances in clear aligners where we can actually make our own clear aligners, not have to go through a parent company like Invisalign. We can actually make them in our own office and give them to the patients the same day. Whereas with, other aligner companies like Invisalign, you sometimes have to wait like 6 weeks in order to get your aligner. So some patients, want to start right away. And that's kind of the case that we had today where she really, really wanted to get started as soon as possible because she had like a gap in between her front teeth. So I think it's, really nice and we'll be able to offer better service to our patients as well and more options. There are definitely a lot of general dentists doing orthodontics and Invisalign. I don't think that's necessarily going to be an issue, as long as we're willing to like adapt and grow. But for sure, I think the biggest thing is to set yourself apart, find what makes you special. And that kind of goes back to being well-rounded and like having your hobbies and just find what you enjoy most, and that will kind of set you apart. And that's really what's going to help grow your practice.
So we'll go into a few cases here. So generally, patients could come in with a lot of crowding, overlapping of some teeth. So you can see here, her top teeth, her bottom teeth. I mean, it's hard to kind of fit everything in there, but you can see what a difference we can make with braces, okay? This is what we were talking about earlier in this top picture here. So this was phase 1, early treatment. You can see the top teeth are behind these bottom ones, and it's super uncomfortable for the patient as well. And you can see how we finished here. So in the future, when they get full braces with all the adult teeth, the treatment will just be so much smoother. And then here, this was a great case. Patient was like a thumb sucker, couldn't eat properly. You could see a huge difference with a finally closed bite. So this was a case, a jaw surgery case. So I did work with an oral surgeon. You can see the profile starting here. You can see this is like an underbite. You can see the smaller shaped laterals, okay? So with surgery cases, the orthodontist pretty much kind of makes sure everything's nice and straight, prepare them for the surgery. So you can see after, I mean, huge difference. Her underbite is fixed. She still has the smaller laterals, but they'll typically get this fixed a little bit later. And you can see how she finished here, or progress, almost done. So you can see the laterals are normal shaped, underbite is fixed, face changes. So with jaw surgery cases, I feel like they're really, really satisfying because you can see changes not only in their teeth, but in their whole face. So she was so happy. So this was another case. So big underbite again, but it was more of like a dental issue. So jaw surgery wasn't really needed in this case. So we were able to correct with braces, which was awesome. We also used an appliance that I'll show you guys.
And rubber bands.
Rubber bands.
Yeah.
That was huge.
Yeah, please
wear
your rubber bands.
Exactly. So this is a cool x-ray. It's funny because whenever we would take these in residency, the kids would be like, wow, that's my hand. Pretty much it's awesome. The person who actually created this went to our school. So he's like a really big alumni, and you can pretty much see where they're at with growth, which is awesome. And then this is another x-ray that you can use to kind of see the relationships with their jaws. You can see position of the teeth. If they're really far out or far back, you can see like a lot of numbers here, but you guys will learn that in residency. And each of them signify something important. So it could be like skeletal, dental issues. And so we have to know like a lot of like the normal numbers and see where they're at. So this is the appliance I was kind of showing you guys. And then with rubber bands is huge in our field. So he wore them really, really well. Okay, and with this appliance, so he was able to fix his bite, which was awesome. And then this was another case. So again, you can see a lot of overlapping of some teeth, crowding on the top, bottom, and this was a tough case because her teeth were already so far out. So we had to decide if we would have to take teeth out or can we fix everything with the braces. In this case, we decided on just taking one lower tooth out. So you guys can see here, you can see that the space is starting to close, and then here you can't even tell. So I know this case will like finish up beautifully, and this is a good example of kind of making treatment decisions. I'm a little bit more conservative. I really want to do what's best for them. So it's kind of a good kind of compromise or plan for her. And lastly, this was a really good case. So take a look at her profile here. You can see the lower jaws very far back. You can see a lot of crowding. It's funny because you can't see in the photos, but on the x-ray here, on her lateral cephalogram, you can see the teeth, how they're angled like this. They're very far out in the bone. So you have to make a nice treatment plan to kind of make sure everything's healthy and we can fix her bite and the crowding and her profile. So we used a Herbst appliance in this case. You can see this appliance, so it like exerts a backward force to the upper jaw and a forward force to the lower jaw. It's kind of like a telescopic mechanism, and it works beautifully if the patient is compliant, of course. So you can take a look at how she finished here. Really, really beautiful result. And you can see the difference in her profile as well. So that was really, really gratifying. Okay, so general advice, kind of like what Cyrus said earlier. So don't give up on what seems impossible. In dental school at one point, I thought, I thought it was impossible to become an orthodontist. Like, what everybody would say, I was very overwhelmed, and I just had to remind myself that this is my dream. I've always wanted to do it, and you just have to remember your like end goal. Also in dental school, do not compare yourself to others. At USC, I had like, I think 140 other students in my class. So it can get a little overwhelming because everybody is there, like you're doing the same things. And some people, like they all want to specialize or just do general dentistry. It's just like you really want to just be true to yourself and focus on yourself as well. Write down your goals, make timelines, staying organized, staying positive while taking care of yourself, of course, your overall like well-being, and then just enjoy the journey.
It flies by. Yeah, it really flies by. Yeah, no, I completely agree with all of that. I think staying organized and writing down your goals and timelines is really important. Just because a lot of the times, if you're just organized, that's like half the battle right there.
Yeah.
Just making sure that you meet deadlines and that you're staying on track with what you need to do. But yeah, definitely enjoy the journey because it goes by so fast.
Right.
Yeah.
And then a last thing is make sure you like want to do dentistry or your, let's say if you want to specialize, make sure you're 100% because it is a big investment, not only financially, but of your time, you know. You might have to miss a lot of family events, a lot of important events with your friends, and just make sure you guys really are 100%, and that's why we emphasize shadowing. So
yeah, shadowing is pretty important. I know it's difficult right now for you guys, but you know, try your best because you know, you really want to make sure that this is something that you know you want to do for the rest of your life, just because you're going to give up basically, you know, a good portion of your 20s in order to do that. So you know, you don't want to get to the end and then decide you don't like it after you spend all that time, and especially the loans for school as well.
Yeah, so currently we are working in Buffalo, New York together, actually. So it's a dream that we're at the same practice. We are excited for the future. We don't know what the future may hold, but we're super, super stoked.
Yeah.
And we just made a new page. If you guys have any questions on Instagram, feel free to let us know.
Yeah, please don't hesitate to reach out if you guys have any questions.
Awesome.
Okay. Yeah, or you can email us as well.
Thank you so much. This was very informative. We have a couple questions, if that's all right.
Sure.
Okay, perfect. For number one, it says, at what age should children stop sucking on thumbs to avoid malocclusion?
Yeah, I mean, so honestly, it's okay for the most part, you know, to like age like 4 or 5 probably. You know, you don't want to let it go too much longer than that. You know, even if a kid is still sucking their thumb till like age like 8 or like 9, it can be resolved with like treatment and intervention and everything, but you typically don't want to let it get to that point. The bigger issues are where a patient is like doing it till they're like age 20, and then it becomes like a surgical problem. So a lot of the times, the kid is trying to quit, so you really have to just coach them and try different tactics. Because it's not easy for them. Sometimes they're trying to quit and it's a soothing mechanism, or sometimes they just do it at night and they don't realize it while they're sleeping. So, it's definitely something to work with them on.
Perfect. Another question is, when undergoing the application process for getting into dental school, how is the interview process? What are some things you recommend to prepare?
Practice. Yeah. So, I mean, the interview process for dental school, it's one of those things that like you need to get used to it, especially if you're going to apply to specialties, because it's the same thing all over again. But for dental schools, basically, I'm not sure what it's like now if they're doing virtual interviews, but when we were doing it, you would have to go to the dental school. So sometimes that would cost a lot because you would have to like fly somewhere or travel somewhere and stay in a hotel. And you'll be interviewed either by one faculty or maybe multiple faculty as well as students. I mean, I know at Maryland, sorry, I was on the admissions committee. So we would interview in pairs. So I was the student interviewer and then I would be with the faculty interviewer. And we would kind of like alternate asking questions, and really the interview is just an opportunity, to get to know you. They just want to make sure that you are, well-rounded and you're able to converse and talk with people normally. Because, one of the biggest challenges with dentistry is you could be great clinically, but if you're not able to talk to patients and really, convey to them what's involved with the treatment and explain things to them and be empathetic, because a lot of patients are nervous, then you're really not going to be very successful as a dentist. So they just want to make sure that you're able to kind of like, talk and sustain like a normal conversation. But they do want to get to know you. So, that there are very typical interview questions that everybody should practice. The first one is, tell me about yourself. That's probably going to be the first question you get. The second question is going to be, why dentistry? Another question might be like, why this program? Why this school? Where do you see yourself in 10 years? Those types of things. So definitely, I think practicing really helps. And you should practice with multiple people and often, just because you'll find that, at least like I went on a bunch of interviews. And so I felt like the first interview was like kind of tough just because like I practiced, but it wasn't the real thing. But by the last interview, like, I mean, it was so easy and just effortless just because I had done it so many times. So I think practicing will really help.
And my dad, like he actually would record me, like we would practice the whole thing, me walking in, and it just, every little thing can make a difference really. When you watch yourself like on the video camera or on your phone, you can really see like if you have mannerisms, you're talking with your hands too much, or you don't look really confident. So I think that was really helpful for me.
Yeah, but body language is very important too. So it's not a bad idea to record yourself, because you do want to be confident and have good eye contact while you're talking to somebody, and good gestures and everything like that. They're looking for those things as well.
Perfect. Another student says that she got introduced to dentistry a semester before graduating, and she's saying for someone who got introduced to dentistry late in college but knows what they exactly want, what experiences would you recommend them take? Like, what should they do if they're interested in dentistry but it's kind of late?
Yeah, that's so many people. So don't feel like alone. There's the nice thing is there's a ton of different options. As long as you're doing something productive, it doesn't really matter what you do. A lot of people, if they want to get their grades up, will do like a master's. That will help kind of like improve like GPA, as well as kind of give you that extra degree. And the research helps as well. Going and working in a dental office for a year, that's also a really great experience because it shows you're dedicated and you'll learn more as well. Even just like traveling and volunteering for like, I don't know, Peace Corps or something like that. Those are also very good experiences. So there's no necessarily right or wrong. It's just as long as you're like doing something productive, because they're going to ask you at the interview, you took a gap year, what did you do during that year? And you should have like a good answer as to what you did and kind of why you chose that. You know, it's not enough to just be like, oh, I just kind of hung out for a year and didn't really do much. You know, you want to be able to say something that like you did to try and like help improve yourself or for your future. So I would kind of focus on those types of things, but it's definitely not too late at all. You know, just try and, you know, get more experience and show that you're dedicated and committed.
Perfect. Another student asks, how can you tell if someone requires jaw surgery or when they don't?
So that side X-ray that we had, you know, that's one of the ways to kind of look at it. And then the other X-ray where it was of the hand. So that was developed by Dr. Fishman, who is actually an alumni from our program. And basically, we have like different points that we look at in that X-ray, and based on the different points, you can tell if somebody's done growing. So typically, you can't have any jaw surgery until you're done growing. So you would keep tracking and monitoring someone until they were done growing, and then reevaluate their side X-ray or that lateral cephalogram. And you can kind of tell based on the measurements, as well as like clinical experience, as to whether or not it can be corrected surgically or non-surgically.
Perfect. Another student asks, would you mind sharing some insight about your CV?
Sure.
So for me, yeah, I think I started in college kind of drafting it because you guys will be doing a lot of like, you know, shadowing, volunteering. So it's good to start like organizing it on there. And then with one of my mentors in dental school, so I had like probably 20 drafts because you want to make it really like concise and clear. And then, I mean, overall with time, so like dental school, residency, you want to keep adding to it. So you'll keep modifying your CV to this day.
Yeah, it's honestly an ongoing process. I mean, I started like doing it a little bit towards the end of high school, just because I had a lot of I was shadowing in high school, so I wanted to document that as well as working places. But really in college, I think you need to start like even, you know, as early as freshman year, you know, start documenting things because you want to have a very thorough like documentation and recollection of everything you've done. And then obviously, you know, my God, I had so many different drafts of it. So, you know, just have one centralized long document, and then you can always tailor it and cut and paste things that, like, let's say, are dental related if you're applying to dental school or so on and so forth. You know, as you get more specialized, you may want to cut things out that you feel aren't as important, or maybe add things that are more important. So I think starting to do that as soon as possible is the best thing. And it's an ongoing process. Even now that we've graduated and we're working, you still have to update your CV and resume and things like that, just because, you know, it's important. You know, anytime you have a job, you want to add that to your CV. So I would start doing it as soon as possible.
Perfect. Someone asked, for a child who had braces then stopped wearing her retainers, what would the next course of action be as an adult? Would there be any complications?
Yeah, it depends. So the first thing I would do is just go see an orthodontist, preferably the one that treated you. You know, there's a few different options. You know, one is if you're happy with the way your teeth are and you just want to keep things as is, you can just get new retainers and just hold everything where it is today. If things have shifted, which tends to happen if you're not wearing the retainers, then, you know, doing a small retreatment may be an option. And that may involve, you know, some braces, or like we offer lingual braces, or clear aligners. And really that's just more discussion to have with the orthodontist, because they also want to check and make sure everything's okay. You know, one of the biggest issues with, you know, the direct to consumer ones like Smile Direct Club is that they don't really do a thorough evaluation and take like an x-ray. So one of the issues with orthodontic treatment, and this happens with everyone, is that your roots get a little bit shorter. It's perfectly normal to have your roots get like 1 millimeter or 2 shorter throughout orthodontic treatment. That being said, some people react a little bit differently and their roots can get significantly shorter. You wouldn't know this without taking an x-ray. So if somebody were to have orthodontic treatment when they were younger, finish and then later on go do something like Smile Direct Club without seeing a dentist to check their roots, it could be catastrophic and they could end up losing a lot of their teeth. And making the root resorption worse. So my first recommendation would be go see an orthodontist and just kind of like do a consultation. Most orthodontists do free consultations, so it wouldn't cost you anything. But then they can kind of explain your different options. But typically the options are get a new retainer and hold everything as is, or do a small like retreatment just to straighten out any little shifting that happened. And typically you can do that with clear aligners.
Perfect. Last two questions, but first up, is there something you wish you did differently in dental school?
No, I don't know. I'm pretty happy with everything. I got into my top program and I enjoyed dental school. I think I really it wasn't easy. It wasn't easy, and there was a lot of times that I was like studying on the weekends and, but it was all a sacrifice and an investment so that, I could have good grades and get into ortho. So I don't think I would change anything, honestly.
I would say like maybe just, take a breather, enjoy the journey a little bit more. I put a lot of like pressure on myself, and like I told you guys, don't compare yourself to others because it's so easy to get overwhelmed in dental school. So that's what I would say.
Perfect. And last question is, how do you cope with the patient's expectations? What's your favorite procedure to do?
My favorite thing to do is take the braces off, because that's when everybody's happiest. And I think, expectations are something that if you set the expectations early, it doesn't become an issue. So if you start like promising things that you can't 100% deliver on, or if you don't set expectations, then the patient will just make up their own expectations in their mind. So I always make sure to be like as thorough as possible with them at the consultation before we even get started, just to make sure we're all on the same page and they know exactly what they're getting. And I think that's super important, just to be upfront and honest with patients. And they tend to respect that, and if they're not happy, with what I can, promise them, then, they can always go somewhere else. But it's one of those things where you don't want to like promise anything that you can't deliver on. And really setting the expectations early is important. Otherwise you could run into issues later on down the line.
Perfect. Thank you so much for joining us today. We truly enjoyed it. We've learned a lot about orthodontics and just general dentistry itself. So thank you so much for being our guest today.
Absolutely.
Thank you guys.
Thank you. Just a reminder to everyone that in order to get your hours, you'll have to take a short quiz, which is located in our Instagram bio. Thank you.